Hello everyone, in this video we will be seeing about the facial nerve. So first we will see about the segments of the facial nerve. So basically four segments of facial nerve are there. That is the meatal segment is there, labyrinthine segment is present. In the middle ear there is the horizontal segment which is also known as tympanic segment, and in the posterior wall of the middle ear there is the vertical segment or the mastoid segment. Okay. Now first the meatal segment. Now meatal segment, it is present in the internal acoustic meatus. It is about 10 long in length. Then comes the labyrinthine segment. This is the labyrinthine segment. It is 3 to 4 long. It is the narrowest and the shortest part of the facial nerve, and it is the most common site for the viral infection because it is the narrowest part. Then comes the first genu. This is whole of the middle ear, then first genu, and here comes the horizontal segment or the tympanic segment of the facial nerve. And then comes the posterior wall, in which there is the vertical segment, which is also known as mastoid segment because it is present posteriorly. And then after that it exists through the stylomastoid foramen, and then it gives 5 branches. So this is it. Now I will tell you about the bony landmarks of the facial nerve in the middle ear, middle wall. Then here comes the bony landmarks are very important. First of all, at the first genu there is geniculate ganglion. Then here it is the lateral semicircular canal. This is the oval window, and here is the processus cochleaformis, and here it is a bone which is known as cog. And at the posterior wall there is there is a pyramid is present. This is the pyramid in which this vertical segment is present, and this is the stylomastoid foramen. So this is the basically intratemporal segment of the facial nerve. 4 segments are written here. Also the vertical segment, it is most commonly injured in the mastoid surgery, which is at the second genu. Okay. Now comes the branches of the facial nerve. So again there are 4 branches of the facial nerve in the intratemporal branches of the facial nerve. So this includes, first of all, from the meatal segments, here at the first genu there is greater superficial petrosal nerve which supply 3 things, that is lacrimation, nasal secretion, and this palatine secretion. Then comes the horizontal segment, and then in the vertical segment, here it enters into the horizontal segment. Then in the vertical segment, at the level of pyramid, it gives second branch, that is nerve to the stapedius, which is the efferent nerve. And what does this do? What's its function? It maintains the stapedial reflex. Now stapedial reflex, in the absence of stapedial reflex, we can call that known as hyperacusis, and that is normal sound appears very loud to the patient, that is hyperacusis. Okay, then next comes the third branch, that is after it exists before the stylomastoid foramen 3 to 4 centimeter before that, it gives another branch, that is chorda tympani. Now it comes here then it enters into the posterior wall through a foramen, and then it goes into the medial wall, and then here it enters into a foramen and then exits, and it gives supply to the anterior 2/3 of the tongue, and it also supplies salivation from 2 glands, that is lingual gland and submandibular salivary gland. So this is chorda tympani. Also then here it then goes into the posterior wall to give sensory auricular branch. Okay, so sensory auricular branch, what does it supply? It supplies to the posterior superior part of the external auditory meatus and its adjacent external auditory canal part. If it is not present, then there is hyperesthesia of the posterior superior part of external auditory meatus, which is seen in acoustic neuromas. Okay. So its clinical significance, it is, if it's not functional, then there is hyperesthesia or anesthesia of that part, which is seen in acoustic neuroma. So this is the temporal branches of the facial nerve. 4 branches. It was greater superficial petrosal nerve. Then second comes the nerve to the stapedius. Then third is the chorda tympani, and then fourth is the sensory auricular branches. Now the functions of the facial nerve. There are basically 4 functions, that is general visceral efferent, special visceral afferent, general somatic afferent, and general somatic efferent. So here it has been, you have studied it in the anatomy in first year. This is just a brief description about it. So parasympathetic secretomotor supply to lacrimal, submandibular and sublingual salivary gland, that is by the general efferent. Taste from anterior two-third, that is we have seen taste from the anterior two-third, that is chorda tympani. Special visceral afferent. Then cutaneous sensations from the pinna is general somatic afferent, and motor supply to facial nerve is general somatic efferent. These are the 4 functions of the facial nerve, and that's it. I was studying this in my reading room. This is my reading room, and this was the topic. Thank you so much.